latest advances in colon cancer screening and detection?
There's a lot of movement in this space. We're always trying to improve our ways to detect colon cancer early, and particularly when it's at the precancerous stage, these polyps or growths that we worry about. We're also trying to understand if we can create risk scores to better understand when somebody's at risk. Because right now we just use age as a cutoff, age 45 and older for individuals that don't have symptoms or a family history. But we understand that that's imperfect, and some individuals probably need to come to the screening fold earlier. And the good news is some individuals can probably wait. So putting all those factors together, that could tell us somebody's risk at any given time point, so we can advise them on screening or no screening. The other important advancement is development of blood-based tests for colon cancer screening. Up until now, our options were either a screening colonoscopy or a stool-based test. But now there's one FDA-approved test for a blood-based test option, and there's probably one more that's close to approval. And in the next few years, we expect several more. So this field is only going to grow in terms of options that patients have.
Wow, that's really exciting. Who can access this blood-based test?
And this test is approved for Medicare patients, so individuals that have Medicare coverage. Other commercial and other payers have made kind of a case-by-case basis. So with any other insurance carriers, check with your insurance carrier if they do cover the test or not.
That's good to know. So what about artificial intelligence? Is that impacting advances in research for colon cancer screening?
Absolutely. I think AI is in every aspect of our life. So in terms of colon cancer screening, it has two applications currently. One is development of these risk scores that I mentioned. So essentially looking through the chart or a person's journey up until this point to put together either information or sequences that we as humans can't really detect, to tell us who is at risk for colon cancer that we should bring into our screening fold. The second application is some of these newer blood-based tests are using AI to improve their algorithm. So they draw blood and try to detect signal in the blood for any small amounts of DNA that's shed from a growing tumor or cancer. But then they used AI and machine learning to improve that algorithm. So we think it'll help make the tests more accurate. And the third application, which we use a lot of, is in colonoscopy. We now have computer-aided detection. So it's an AI software that actually looks along with us. The idea is it gives us a second set of eyes so that, when we're doing colonoscopy and if we happen to see a polyp, the AI system actually also looks with us and points our attention to things that perhaps could be polyps that we could easily overlook, ensuring that we have a high quality colonoscopy and we don't miss any lesions.
Can you tell us about the areas of colon cancer research that you're currently involved in?
Yes, absolutely. So in terms of clinical research, at the moment, we are conducting a clinical trial to understand the best way to improve colon cancer screening rates amongst individuals that may have low screening rates. And our study is currently focused in multiple community clinics across New York City, where there's a lot of individuals that are non-English speaking or underserved, and we're trying to understand and boost adherence rates to colon cancer screening. We're also doing studies on developing new biomarkers, including blood and stool tests, so that we can understand how to improve existing colon cancer screening studies, with the idea perhaps that we can have a more sensitive and a more accurate non-invasive test in the near future.